Cree, and welcome to the latest edition of the Dr. Cree and Me Show. Thank you for joining us. We are so excited to be here to drop some knowledge once again. I'm not sure what week we are on the Dr. Cree and Me Show, but when you get here, drop your name. Let me know that you're watching, and that way I can know where that you're watching and where you're watching from. Hey, Miss Pam, how you doing? How are you doing? You making it all right? Hey, Montez. I hope you guys are doing well with the world starting to open back up. Today we're going to talk about antibody testing and if we need that or not. Today is the 12th, right? 2020. Hey, Aunt Queen, how you doing? Hey, Neek. Am I saying it right, Neek? Hey, Kia. Make sure to share the live. We're gonna talk in a minute about antibody testing. Antibody testing. Okay, so all right. So we're gonna get started, guys. Hey, this is Dr. Cree. I am a board-certified family medicine physician, and I specialize in helping everyday, overworked, overwhelmed, regular people learn more about their healthcare needs, learn more about the current events that are affecting our healthcare, and I also try and let you know that if you know better, you can do better. And when we can do better, we probably can live longer, right? Anybody here want to live longer? Live healthier, live happier, live whole lives. Hey, Dr. Dina. Hey, Latanya. Hey, Cynthia. All right, guys. So let's get to it. So let me know. Give me a little thumbs up if you have heard about antibody testing for the coronavirus. Anybody heard of antibody testing? Let me know. Let me know. No one's heard of it? Anybody heard of antibody testing? So let's talk about antibody testing. So first of all, when you are going to the drive-through testing sites or you're going through your doctor's office, that is talking about real time. So they stick the Q-tip in your nose, they stick it all the way back, looking for a hard feel, stick it back some more, right? So that's gonna tell you if you have coronavirus right then and there. Okay, guys, I see the lights. I see that you guys have heard about it. So that's gonna say right now in this snapshot of a moment that we do have coronavirus, okay? So antibody testing, there are two different kinds of antibodies, guys. There's several different kinds, but we're gonna talk about in this setting, we look at IgM, which tells about a recent infection. That means less than 14 days, or early post-infection. So somebody put that in the chat. Number one, IgM antibody is if you have been infected recently within the last 14 days. But what they're testing for in most of the tests are IgG antibodies, which is, in school we had this mnemonic where G stood for gray and your shadow is gray and the shadow looks backwards, so that's in the past. So that's how you can know. IgM is recent. IgG is if you've had an infection in the last 2 to 4 weeks. So if you've had an infection in the last 2 to 4 weeks, your IgG can be positive. So that may, if you're like, oh my gosh, Grandma, I visited my mama for Mother's Day. Did y'all go visit your moms for Mother's Day? And if you did you wear your mask? Did you try and social distance? Did you stay in the yard? Did you do all the things that you know that you were supposed to be doing? Or did you go out up in her house and touch all over everything and put your mom in more risk for the sake of saying that you visited for Mother's Day? So IgM is recent. IgG, hey Pastor V. IgG is within the last 2 to 4 weeks that you've been infected. So a lot of the tests that are coming out now are saying, get IgG tested, get IgG tested. Hey, Catrice, get IgG tested, IgG tested. However, guys, what if you were tested 3 months? What if you were tested positive in February? So that's more than 4 weeks. So we have a lot of different variables when we're looking at this test. So if your IgG is positive, that means that you, yes, have had the virus here in the last month or less. Hey, Saint Bell. So you've had the virus, and that means if you've had no symptoms and your job requires that you get tested for the IgG antibody, then you could have been spreading this infection to other people, to people that you don't know, to people you love, to anyone that you've been closer than 6 feet contact with. So the antibodies are IgM, which if I've been infected within the last 14 days. IgG is I've been infected within the last 2 to 4 weeks. So what does this tell us, guys, right? So IgG does not mean that necessarily, we're not really sure if it means that if my IgG comes back positive, it does not say, hey, I'm totally immune from the coronavirus. If I get it again, I won't even know it. Or if I get it again, it'll be a mild infection. We do not know what it means. Other than it means that you've had the virus. Or it means that your body has mounted up enough of a response to the virus to show that, hey, I've come into contact with what's called SARS-CoV-19, and your body has gone to battle for you. Your body has fought for you. Well, say for instance, so it's very complicated in that, guys. You have like your innate, hey Kisa, you have your innate immune system where it's like, okay, we're not even working real hard. We see something, we recognize it, we come out. Then you have that adapted immune system that's like, we calling everybody in, we calling all the troops to war because this is big. So if you have coronavirus where you end up sick and on a ventilator, on a respirator, on dialysis, you're gonna call all your body's army, all the members of your body's army to come in and fight. So you should be able to mount enough of a response that when they go and check to see if you've had it in the past, that your IgG would be positive. That's the expectation. But it may not be the case for everyone. So what symptoms will you have? Know if you have it. I just came on. I'm sorry, you're gonna have to ask me that question again, Samantha. I'm missing some words there. So ask me that question again so I can answer you. So you can have, so let's go back and be reminded, coronavirus is ever changing. Remember when we first were saying a fever, we were saying shortness of breath and cough. Well, now we know we got all that, plus we got GI symptoms, losing your sense of smell, having watery diarrhea, having no taste. Those are all symptoms. Having pink eye, having sores on your feet. Now we see that it's affecting children. I'll do a whole separate live next week on what's going on with kids and how it's affecting kids' hearts, kids' vessels, that kind of thing. So it's evolving, Samantha, if that's your question on what symptoms are we looking at. Or you could have zero symptoms at all. Remember, you can be totally asymptomatic and walk around here sneezing and breathing on people and spreading it. So IgM, for those of you guys that are just coming on, IgM antibody, if that's positive on your lab, that means you've been infected within the last 2 weeks, the last 14 days. If your IgG is positive, that means you've been affected between 2 and 4 weeks in the last 2 to 4 weeks. If your IgG is positive, that means, yes, you have had the virus at some point. Now, you may or may not have had that list of symptoms that I just talked about. So the killer is having this positive test does not really give me as a clinician a whole lot of reassurance other than if you're getting a test routinely, right? So if I have a negative today and I test in 2 weeks and I'm positive, then I know, well, I had it then. But if you're not kind of getting tested on a regular basis, it may not be of much value because we don't know if IgG means I'm totally immune from coronavirus, that I'll never get it again. We don't know. It does not protect you. In our mind, you're not protected from being reinfected. It just says that, hey, you've had it in the past. It's just proof of immunity. So, but we don't really know. We have no clue what that means as far as how much of immunity. Am I 100% never gonna have to do anything, take any medicines for it, because my body's going to be exposed to it again, and my body's going to know what to do. We don't know. So that's the point, guys, about antibody testing. A lot of people have been saying, I just need to have antibody testing. Antibody testing is going to say yes or no, you've had the disorder. So about the testing, there are a lot of people trying to get rich during this time, guys. We know that. Catrice said, I have to take this test Friday. This is great information. Well, good. Hopefully you pass your test, honey. So a lot of people are like, I just need to have the antibody testing. Well, you need the antibody testing to say, yes, I have had it. That's the question. That's 100% what you will know. Know that all tests are not created equal. So when you go in and they're saying, hey, your employer is requiring you to get antibody testing. So the question that I would like to know is this an FDA approved test? Some questions that you can ask your employer or anyone that's requiring you to have. Is this an FDA approved test? Okay, if it's not, then what's the false negative rate? What's the false positive rate, right? Oh, have to take this test. Oh, you're saying you have to take this antibody test, not a test. I understand now. So you need to know, is it an FDA approved test? And is this test, what is the false negative rate? So how many people actually have a negative test and they really have the disorder? They really have had it? Or how many people test come back positive and they really did not have it? So these are the kind of questions that if you're having a test, or if your person doesn't, whoever is testing you, if they can't answer these questions, then I challenge you to be kind of leery, because these tests can be kind of expensive. I do know with Quest Laboratories, if you do not have any insurance, the test is $55, okay? Or if your insurance does not cover it. But some insurances are covering it if you can say that, yes, I've had exposure, or yes, I've had symptoms in the past. So remember, antibody testing is not the same, guys, as the test that you're seeing on the internet where they're sticking the tube out, the Q-tip all the way down to the back of your throat, right? That is the test that they run it through PCR. They're trying to check and see if you have it currently. Antibody testing says, yes, you had it, and you had it either 14 days or less if your IgM is high, or you've had it 2 weeks to 4 weeks ago if your IgG. So there, at this point, there are no titers that we can draw. If you have had hepatitis B testing, if you've had measles, mumps, rubella test vaccine, if you've had the vaccines for measles, mumps, rubella, you've had the vaccines for hepatitis B, then you know that every so many years, especially if you're in healthcare, you may have to go in and get your titers. That says your body is still immune to it. Your body is still immune to measles, mumps, rubella, or it's like, oh no, you're no longer immune, so you have to get the shot again. Or you're no longer immune to hepatitis B, you have to go through that series again. So that's similar to this. They're looking for the antibodies to show that if this bug shows up into your system again, your body should be able to react in a way to call all of the people in all of your body's army fighting, to fight off the bad guy. We're coming, Dr. Cree, we got you. We're going to show up and we're going to beat the coronavirus because we've seen it before and we have enough immunity to kind of break it down. However, coronavirus is not acting like measles, mumps, rubella. It's not necessarily acting like hepatitis B. We do not know if, because you have the positive test, if it means, what does it mean going forward? We know that it means that you've had it before. But we don't know if that means going forward that you'll never have to deal with this again, that your symptoms will be less. You may get it worse the next time that you did it. So as of right now, use your antibody testing only as proof to say, yes, I've had this infection, or no, I have not. And that's all that I can say. We deal with evidence-based medicine, right? That's all that I can say with good conscience to say if you're getting an antibody test, it only tells you here recently if you've had it or not. So remember, false positives can happen, and then some of these tests can cross-react with the other coronaviruses. Remember in the past we talked about this is not the first coronavirus to ever come out. This is just a specific mutated form of the coronavirus. So some of the tests may come back positive, but you may be positive for coronavirus number 1, 2, 3, 4, 5, whatever it is, random, another coronavirus that you had when you was 7 years old, okay? So you may have those false positives because your test may react to other coronaviruses, not necessarily specifically the COVID-19 strand, SARS strand. That's the test that your test should be looking at. Ask your people, is this for the SARS? Which one is it for? Or is it for every single coronavirus that's ever out there? And then remember that false negatives can happen. You can have a negative because your body didn't mount enough of a response to show a positive test. So it may have only used your innate immune system and it just caused 3 or 4 of the army members. Just a few generals showed up and fought for you and knocked it all out. And you did not need every person in every division of the armed forces of your body to fight that thing off, which is a blessing. But however, your antibody test for IgG may be falsely negative. So be mindful of what you're getting into. And yes, must schedule an appointment with Quest. Some people are doing, I've done it in my, Tamisha, I've done it in my office. And it's just a blood draw when we send it and it comes back very quickly. I drew one yesterday, middle of the day, and I've gotten the results back this morning already. Okay, guys? So remember, IgG says, yes, you've had it. If it's positive, you had it in the last 2 to 4 weeks. If your IgM is positive, you had it in the last 14 days. Remember, there are false negatives, there are false positives. What this test shows us is you have had it in the past. We're not clear on what it shows us about going forward. So you don't say, I've had coronavirus, bring everybody to my house, let me get everybody else sick so you can get it too, because we're unsure of how much what happens going forward. Are you still shedding it? We don't know. Are you going to get it exposed to it again? Is it like a common cold? You get exposed to it again and your body says, I recognize this. I recognize this bug already. And let's just send a few, just the army. Or is it still going to be as big and as bad and as mean as it is today and as rough on your body that your body says, I need the whole, everybody. I need the Marines, I need the Army, I need the Navy, I need the Coast Guard, I need all of your immune system to come together and fight. Okay? Can you have the test done more than once? Yes, you can, Danielle. You can have the test done more than once. I'm not sure what insurance is doing at this point. I don't know if there's a limit on how much they would, how much they will cover and how often. But I do know with Quest, the cash price is about $55. Hey, Ray. Anyway, that's what I have for you guys today. Know that it's out there. People are advertising it. You guys, it's up to you to ask the right questions. What's the false positive rate? What's the false negative rate? Is it specifically for SARS, COVID-19? Or is this for every single coronavirus in the world? And remember, we don't know what this tells us going forward, but we do know what says going back. Hey, Miss Amelia, I'm excited about the restaurant opening back up. We can't wait to get in there when we can get in there. I'm not saying about recommending it for everyone. If you feel like you've been exposed, Miss Williams, if you feel like you've been exposed, or if you feel like 2 months ago you were sick as a dog and the flu was negative, the strep was negative, everything was negative, then you may be someone that say, hey, let me go get the test and see if I've had it in the past. If you've had the symptoms and if you could have possibly been exposed, then yes, I do recommend you being tested to see if you've had coronavirus in the past. Okay? Again, this is Dr. Cree, and thank you for joining me for this edition of the Dr. Cree and Me Show. We try to challenge you to learn more and more about your health, because when you know better, you can do better. And I'm here to help overwhelmed, overworked, oh my gosh, I'm pulling my hair out because there's so much information out there, kind of people, to just know better. And when you know better, like I said, you do better. You can live a healthy, happy, whole life. Be careful out there, guys. Be safe. Wear your mask. Even if you feel like you can't breathe through it, wear your mask. Wash your hands. Throw your disposable gloves away often. And, you know, if you must get your hair done, you say, I got my turban, I'm cute with it. Be cute with your look, okay? Be cute. Anyway, I'll answer more questions in the chat, but thanks for joining. Don't forget to follow my YouTube page, Dr. Cree's YouTube page, and you can see all of the other videos and catch up on what you've been missing. I'll answer the questions in the chat if you have any. Anyway, thank you. See you next Tuesday.